Just three ordinary guys trying to understand the crazy world around them. We don't have all the answers, but we've got all the questions. You're listening to Just Add Bourbon with Jimmy, JD, and Brad.
Welcome, everybody, to the Just Add Bourbon podcast. I'm Jimmy Don Kerr.
I'm Brad Broadus.
And I'm JD Damon.
And guys, when we started doing the podcast a few months ago, there was one topic that I think all three of us were really interested in doing a show on. And that's an issue that has affected our country, but no more so than our little area of the world here in Eastern Kentucky, and that is the opioid epidemic. And so what we had hoped to do was do a show ourselves, which we recorded last night. And then we hope to do a series of interviews with people who have lived through addiction, came out the other side. And today we get to do what we hope to be the first of several interviews. We want to welcome Matt Brown and his wife Summer to the show. Guys, we appreciate you all taking the time to sit down with us and discuss this important topic. And we, JD and I, know Matt. And JD graduated high school with Matt. Matt graduated high school with my sister. And I always knew Matt. He was the valedictorian of the class. He was a basketball player. And then you know how life goes. You just
more so a bench warmer, but I was on the team.
You were on the basketball team.
Yeah.
So, time goes on and you kind of lose contact with people. And then one day I'm sitting at home and I'm scrolling through Facebook and this post comes up. And it's you talking about your struggle with addiction. And I was like, whoa, how did that happen? So can you kind of walk us through from the beginning your story?
Absolutely. And guys, thanks for being here today and for asking Summer and I to be a part of this, because one of the things that we've done over the last few years is we've basically given our life to helping people understand what addiction is, what addiction isn't, and how that today in 2019, there are services available that allow people to get better, and people don't have to hide anymore that are struggling with addiction. My story is a story that started back when I was in high school, or maybe even before that. I was raised in a good home. My dad, coal miner, worked 60 hours a week and taught us right from wrong. My mom worked in the school system and then eventually moved into working at the county clerk's office. But, they didn't drink in front of us. They didn't use drugs in front of us. They taught me right from wrong, and they took us to church every time the doors were open. And one of the things about my story that I always point out is that none of the factors that I'm about to describe to you will remove my personal responsibility in the decisions that I made, but some of the factors that contributed to me making wrong decisions were I was raised in a very legalistic, rigid church structure that didn't really fit well with me. I'm a very inquisitive person, so I'm going to ask questions about everything, and I want to know why, and I'm not going to be okay with you telling me that I have to do something unless I can understand the why. The church I was raised in was all about rules and regulations, and they weren't okay with you asking questions, and I basically... I'm paraphrasing, but I heard oftentimes, just shut up and believe, because it says it right here, just shut up and believe. And so at some point in high school, I made a decision. And at the same time, these folks who were deciding that I needed to follow all these rules to be a good person were also very sexist and racist, and they were demonstrating qualities that didn't really add up to a good person to me. And so I made a decision at some point, okay, if this is what it means to be Christian, I'm going to find whatever the opposite of that is, and I'm going to be that. Now, I can look back at all that today and realize that I was hypersensitive to a lot of things and that they weren't bad people. They were just as imperfect as all of us, and they were just doing the best they could with what they had. But at that age, it didn't sit well, and I made some decisions to rebel. And I eventually was playing basketball or sitting the bench, like I had said before, and I thought I should be playing more and ended up quitting the basketball team in my junior year and should have just stayed and been a part of the team, but I chose to quit and had a lot of free time on my hand. Had identified as a basketball player for so many years, I didn't know what was next in life. I made good grades. I've always been able to take tests well, so school wasn't a challenge for me. That coupled with free time, coupled with rebelling against the church, not really knowing who I was, dealing with some bullying in my junior and senior year of high school, created a perfect storm to where the first time I was offered, not the first time, when I was about the fifth or sixth time that I was around alcohol or drugs, I said yes to marijuana. That was actually the first substance I used, it was between my junior and senior year of high school. And the interesting thing is, and I know that opinions on marijuana are all over the place. My opinions about marijuana are all over the place. But I know that my first use was marijuana. And whether it's genetics or whether it was exactly where I was in life at that time, whatever it was, the very first night that I smoked weed, a switch flipped in my brain. And I did not stop chasing some form of drugs or alcohol for the next 18 years. Now, I wasn't immediately physically addicted to marijuana, but I was addicted to the chase of getting your drugs, of the thrill of it being in the black market and you having to, hide to go to somebody's house and hope nobody saw you and scrounge up the money to get it, and then addicted to the feeling, of course. And so I smoked marijuana from the summer of my junior year till the time I went to Moorhead, my freshman year at Moorhead. And then I didn't do anything else except for marijuana. And then I tried alcohol at Moorhead the first night I stayed on campus. And fell in love with that just the same as I did marijuana. And by the end of that first semester at Moorhead, I fell headlong into Oxycontin, nerve pills, cocaine, acid, and mushrooms in a 4-month span because it was just, I was genetically predisposed, and I was in a life situation that lent me toward being addicted. I was looking for something. I was looking for happiness, quite frankly, and so that use continued and snowballed out of control the entire time I was at Moorhead. I was there on full scholarship. And so I actually got scholarship plus book money, plus food money, plus money left over every semester. And so I would take that money left over and purchase drugs with it and then sell drugs and back and forth and scheme people over to have enough money to use drugs. And it was during the Oxycontin rush, and it was everywhere. I had guys that you and I know well, and you and I know well. One of them isn't even alive anymore because of drugs. They were 19 years old. They got in a fender bender minor car wreck. Somebody rear-ended them barely. And they ended up going to a doctor in Paintsville, Kentucky. Can't remember the doctor's name. And got boatloads of Oxycontin every month at 19 years old. And would bring them to Moorhead, and I would sell and do and take half of them. But so that happened all throughout Moorhead. Got accepted to UK's physical therapy school. Completed that program. I was in Hazard, Kentucky at that time, and that was another area that was just completely overridden by drugs. Graduated from physical therapy school, full-blown opiate addict. I would later find out that I was an alcoholic too, but it paled in comparison to the intensity of the opiate addiction that I didn't even notice that was also a problem. And started making good money as a physical therapist, and so my addiction just kept getting worse and worse and worse and worse. Crashed my life a half a dozen times between 2003 and 2014. Lost a house, lost cars, lost jobs. Somehow I'd never lost my physical therapy license. I bet I lost several jobs. Went through a divorce somewhere around 2010. Was homeless for a period of time, sleeping in my car because my house got foreclosed. While I was making $106,000 a year and was sleeping in my car because I couldn't put the pieces together well enough to pay my house payment. That's how severe my addiction had became. And, fast forward to around 2011, and Summer and I met, who's sitting here with me tonight. And when we met, I had literally I'd had like a 2-month good spell where I wasn't stealing everything I came across and pawning everything. And I wouldn't dare say I was in a good place. I just wasn't in the worst place. But I was always able to function-ish. And Summer and I met and we hit it off, and I thought I finally found the person that's going to fix this problem for me. I'm going to be able to get right now because I found the right person. And I had the best of intentions, and we got together. She didn't realize, she knew the exact conversation was, one day she said when we were dating early on, she was like, well, I've got something to ask you, I've heard that you used to be wild. And my response was, that's right, I used to be. The part I didn't explain was I still was or was about to experience my addiction in a whole new way again. And we got married, and she saw some red flags, and I'll let her talk about that a little bit later when she talks. But if you don't know addiction and you've never been raised around it, you don't really know what you see. Something's off, but you might not know exactly what you're missing or what you're seeing. And so I eventually ran our finances into the ground, stealing from our bank account, stealing from our house, pawning our TV, pawned our lawnmower, and pawned if it wasn't nailed down, and there was a few things nailed down that I tried to take, I pawned everything. And one day I got home, and she'd been trying to help me for a few months when she realized what was going on. I got home, and she said, and she was sitting on the couch, and she had all these parking tickets laying out that she'd gotten the mail from. I was working in Williamson, West Virginia as a physical therapist, and I'd gotten a dozen parking tickets and hadn't paid them, and there was like a $600 bill that came in the mail. And she was like, I can't help you anymore. You don't have to, I don't care where you go, you just can't stay here anymore. You gotta go. And I had knew someone who had just went to treatment through addiction recovery care, where we're sitting today. And they went into treatment a mess, and it came out a completely different human. And I knew the day, I thought we were going to be divorced because Summer had never had that in her family. That's not something they dealt with. All good, upstanding citizens, and just, I figured, okay, we're done. I'm probably just going to have to let her go, and I messed up. But I knew that whether she stayed or left, I had to get better to have a shot at life. Even if she was going to stay, I had to get better. And so I went to my parents and said, I'm ready for help. And they knew, they didn't know, but they knew that I was in bad shape. It wasn't hard to miss at that point. And I called Addiction Recovery Care, and they got me in within about 48 hours. I went to treatment, I was working as a physical therapist on a Tuesday, treatment on a Thursday. And while I was there, I received holistic care. Like true, people use that word all the time for a lot of things, but they treated my entire person, because addiction devastates everything about a person. It robs from you. So addiction recovery care has a medical staff, got physicians, nurse practitioners, and nurses. Because by the time you go to treatment, you've not been to the doctor in years. I didn't use intravenously, but if you're an IV needle user, you may have hepatitis C or HIV. You're not checking to see if you've got high blood pressure. You're just not checking anything.
You're just worried about chasing the pill.
That's right. And you're mixing drugs, and you're not taking care of yourself. So they take care of your body. And then they have a full counseling staff with counselors, social workers, case managers, peer support specialists that help you change your behavior and help you get to the root cause of why you started using in the first place. A lot of programs will try to just make you change the way you act, but addiction recovery care helps you find out why you were doing that in the first place. And for me, I clearly can articulate lack of identity. Church environment wasn't helpful for the type of person that I am. I dealt with bullying and quit basketball, and I just did the wrong thing. So they help you get to the root of why you used. We're also, not only are we a healthcare entity, but we're a ministry. This organization was started by Tim Robinson, who is also from Martin County, and he was a barely functioning alcoholic prosecuting attorney in Lawrence County who got saved, got sober, and felt called to quit being a lawyer and start a ministry to help people who were struggling. And even though we've transitioned from grassroots ministry to industry-leading business, we're still very faith-based. We have chaplains at every single center that we operate, both residential and outpatient centers. And we have a discipleship program, and we basically help teach people that God can be a source of forgiveness, a source of hope. It's important to have a prayer life, and it's important to find a group of people who believe similarly as you do to do life together. That's a very important part of our program. So much so that I entered the program as an atheist, and today I'm a pastor of a church in Louisa. And people always ask, how's that possible? And one of the ways that's possible is because addiction recovery care didn't push anything on me. It was there for me to experience or not. And that approach helped me move into a relationship with Christ that forcing something on me actually had the opposite effect of. And so strong spiritual component, but some people take it and some people leave it. And that's fine with us. We understand everybody's on a different path. And then lastly, another thing that sets us apart at Addiction Recovery Care is that we believe that you probably won't maintain long-term sobriety from drugs or alcohol if you don't discover that you have a purpose in life. And so we have a very strong vocational component to what we do. And one of our major taglines is we take you from crisis to career. We have 6 job training tracks that people can choose from and enter into while they're in treatment with us. And they, with meaningful employment opportunities at the end of those programs. So much so that today we have 600 employees. Half of the 600 are people in recovery. 200 of that 600 are people that have graduated from our program, people like me, who now are employed in the company. And we have people that are employed that are graduates at every single level of the company. My title is Chief of Staff to the CEO, and my job on a day-to-day basis is literally to help Tim, our CEO, run the company and do anything he needs me to do, big, medium, or little, to help make that happen. That's my desk there. Right here is another program graduate, Kayla Parsons. She's not in here, but that's her desk. She She's deputy chief of staff. Her job is to help me and Tim do everything we need to do to run the company on a day-to-day basis. But we've got people at that level and all the way through the organization. And what we've seen is pairing drug treatment with job training makes a difference in people's lives. And I know I've talked a lot there, but I'll kind of just digress a little bit and we can take that wherever we want it. But that's my story. That's my background.
And that's what we was looking for. Right?
No, that's exactly what we were looking for, Matt. And we appreciate you sharing that with us. We really do. And my experience with addiction recovery care has been, from a business standpoint, I can't tell you how many people I financed homes for who came through this program.
That's awesome. I didn't know that to that level.
And shared their story with me as we were getting to know each other through the process. And so it was one of the reasons I was, really good to catch up with a friend, but at the same time, talk a lot about what this program does for the people here in Eastern Kentucky. We were, doing a podcast last night talking about this very subject. And one of the things that we were saying is, how can we solve this? Because there's so many levels to it, from big pharma, you got the doctors, you got the pharmacists. And, we were kind of saying, well, for us, maybe it starts at home with our kids, having the conversations with our kids, sharing stories with our kids, people we knew, things that have happened. And then places like this. And I totally believe in what you guys are doing. And, pairing all that, I agree with the purpose, the job, and the holistic approach at the same time. I just think that's phenomenal. I really do. So I know, Brad, you maybe had a couple of questions.
Well, I've got a question for Summer first. You kind of came in, obviously there was already a problem that you maybe didn't know so much about at the time when you all met. At what point did you realize, okay, this isn't just something going on the side. This is a serious crisis. And what did you feel going through that process?
I guess we were 2 years into, I think, our marriage. And up till this point, I have been pretty much clueless about addiction. I didn't know anyone, or I thought I didn't know anyone that was addicted. And I had a very specific picture in my mind of what an addict looked like. Mm-hmm. And it wasn't someone who got up and went to work every morning. It wasn't someone who drove a nice vehicle. It wasn't someone who lived in a beautiful home. So that was kind of the last possible idea I had when I was trying to figure out, okay, something's not right. All this money's disappearing. I thought it was gambling. I thought, is there another woman he's spending all this money on? So I had all these thoughts, leading up to this moment where it all comes out and we find out he finally kind of just tells me, it's prescription pain pills. And so it literally made me a crazy person on the inside. I was literally doing things I normally wouldn't do. I was pulling up, phone records and searching through phone records and calling all of these numbers to figure out who are these people he's talking to. And it was one of the numbers I had actually searched in one of my just moments was a pawn shop. And that's when things started kind of coming together and realized, okay, he's pawning our things. And he was at work in Williamson, and I made a phone call and was like, okay, what is this? I know something's not right. Is it gambling? Is it another woman? And that's when he actually admitted to me that he had a prescription pain pill problem. And I can just remember, feeling like the world was crashing in on me, because when you're a little girl, you don't grow up, just like when he was a little boy, he didn't grow up wanting to be a drug addict. I didn't want to grow up marrying an addict. So it was kind of this whole just world crashing in on you moment. And then you kind of are thinking, okay, what are other people going to think? What do I do? And so it's very, and at the time, I didn't know anyone that had dealt with this issue before. I didn't have anyone to go to or talk to. So we tried to detox at home. And I'm pretty sure he's probably getting high the whole time we were detoxing at home. But I tried everything. I tried to make life easier on him. I tried to be kinder. I tried to be nicer. And eventually those old behaviors start creeping in. I'm still checking the phone records, still seeing, an old number pops up. And even at that point, though, I hadn't kicked him out of the house. This was probably like February, and we hated each other. He hated me. I hated him. We just didn't know what to do. I didn't want to go through the shame of what at the time I felt of the shame of a divorce, or the shame of him being an addict, or the shame of me making the choice to marry someone in addiction. And so we stuck it out until around May 12th. And I got, this very nice large bill for some parking tickets. And that was kind of the straw that broke the camel's back. And at that moment, I was like, I can't do this anymore. I don't have the $600 to fix this mistake. And so I told him to get out, and, I love you, but I can't save you. You're going to have to go get help. And so that was kind of where it ended. He went to treatment. We hadn't made a decision on whether I was staying or if I was done with the marriage.
So Matt goes into addiction recovery care, and you're at home. Is that how it works?
Yeah.
And so obviously you love Matt, but what was your reaction when he came out and he was a different person now?
Well, so that was a slow process. During that time he was away, I have a wonderful mother. I'm so fortunate. I have a wonderful mother. And she was pretty much his parents, and my mother were the only ones who knew. I didn't tell anybody. I didn't tell my friends. I didn't tell my coworkers. And so I told my mom, and she was very supportive. She said, I'm not telling you whether or not you stay or you go. You make this decision on your own. And so I had a good probably 6 months, you think, to really do a lot of self-reflection and heal. And 3 to 6 months?
100 days.
To 100 days to kind of heal from what had happened. And, and through that healing process, I got to go visit him, and I got to see that he was getting better and all the, great things that were happening. And so it took about I had the 3 months, and then when he finished treatment, he didn't immediately move back home. He stayed with his parents, and he was still going to one of the centers to intern, and I was still staying at my mother's. And he came home on the weekends, and we spent the weekends with each other, and we slowly were able to heal with each other. And so I healed on my own, he healed on his own, and then we were able to heal together. And it was a year. It was a year process for that healing to take place.
Matt, on the medically assisted treatment, I know that's something that's used a lot. I'm sure it can be used as a good tool. I know I've had a lot of friends that just used it as something else that they were addicted to. What are your thoughts on that as far as where is its place in recovery and, towards a solution of fixing this?
That's a great question. And it's one of those polarizing topics. So medically assisted treatment, it gets a bad rap because there are a lot of bad actors out there in the medically assisted treatment world. There's a lot of physicians who are utilizing it in a pill mill type scenario, just a legalized drug dealer where you pay them X amount of dollars or use your insurance card to get methadone or Suboxone, and they don't require counseling. They don't require drug testing, and you're literally just exchanging dollars for medicine. And I know that approach, and I know it doesn't work because I went to one of those physicians for almost 7 years. I paid the guy $300 cash. Sometimes he wrote me the prescription. Sometimes he wasn't even in the building, and the nurse wrote it for me, which is not legal, by the way. And I took 2 drug tests in 7 years with this physician and did no counseling. And so it didn't help me at all because that's not it's not how it was intended to be used. Methadone and Suboxone are intended to be a part of someone's treatment. medically assisted treatment. So you should be getting counseling. You should have a case manager. You should be getting all these other services that help you walk out of addiction while you're being stabilized by the medication. And so at Addiction Recovery Care, we utilize medically assisted treatment for people with opiate use disorder. We're not a methadone provider, but we are a provider of Suboxone for people that are qualified and eligible to receive it. I'll tell you that we've had Hazelden Betty Ford, which is a nationwide international leader on this issue. They spent all spring and summer with us training our organization on the use of a new program that they created a couple years ago called the Core 12 program, the Comprehensive Opioid Response Program. And so what that does is that allows anyone that shows up to your door that has an opiate use disorder to fall into one of three categories. And they can float in and out of these categories according to the decision between the physician, the counselor, and the patient. It's a threefold decision. Some people can fall in the of just the opiate use clients, not if you're meth or other. This is just for opiate use. Some of those clients will be in the abstinence track, so they won't be on any medically assisted treatment. Some will be on a steep taper track where they'll get some medically assisted treatment for a short period of time, long enough to help with their withdrawal symptoms, and then they'll be off of it. And then some of our clients will enter into a maintenance track where they may be on a low dose of that even when they leave our center, and then we just refer them to the next outpatient center. If they're living with us and they move back to Louisville, we'll refer them to a Louisville clinic that'll pick up from there and continue to take care of them. And when I first started hearing about that program, I thought, well, yeah, of course, everybody's going to be on the maintenance track and nobody's going to want to come off of it. Hazelden Betty Ford's experience with that program, when the physician, counselor, and client are the ones making the decision, they found that a third choose abstinence, a third choose taper, and a third choose maintenance. And that's what we're finding in our use of the Core 12 program as well, is not everybody's rushing to stay on it forever. And if you think about it, one of the things I remind myself is when I entered the program, I'd had 7 years experience with Suboxone. And even though it wasn't done correctly, I knew I didn't want to even consider that. I would have chose abstinence. It wasn't even a choice back when I went through treatment. I would have chose abstinence. And we're having people still today who don't want to be on anything. But with all that being said, I don't want to dismiss the folks who end up on a maintenance dose, because I'm seeing people come into our centers, our outpatient and residential. So we've got two different kinds of arms of the business. One is you come live with us for a while. The other is you live at your own home and you come get counseling and you go back to your house. Both of those sides of the business are seeing people come in homeless, come in without custody of their kids, come in unemployed and unemployable for that matter, and all three of those tracks, maintenance, abstinence, and taper, maintenance, abstinence, and taper, we're seeing people move from homeless to homeowners. We're seeing people move from unemployable to managers, and not just entry-level employees, but leaders in the businesses that they're either entering or even starting. And they're coming from any of those three tracks.
Do you see a higher success rate in either one of those chunks of the pie versus the other?
Not yet. We have not seen that yet. Now, we've just been utilizing that full Core 12 program for about the last 6 months. And so data is still rolling in. But one of the things we know for sure that the Core 12 program has done is when you enter our program on the residential side, we used to lose a lot of people because of their intense withdrawal symptoms in the first 3 to 5 days. They couldn't even just they couldn't manage it for those 3 to 5 days and would just leave and decide to go get high. And so we weren't even helping a good chunk of people. And we, utilizing Core 12, has cut in our industry, it's called AMAs, which is they leave against medical advice. We've cut that by 25% just over the last few months with this program. What that means is we're helping more people.
So one of the things I want to ask about, and I can't remember the name of the law, it's escaping me. Is it Casey's Law?
Casey's Law, yes.
And now how's that work? Your family members force you into treatment?
Yes. So Casey's Law was created by Charlotte Wethington. Her son Casey ended up passing away due to drugs or alcohol. And she wanted to get him help, but couldn't, and he wouldn't. And after he passed away, she has given the rest of her life to making sure that people who know their kids or loved ones need help can get it. And so she advocated for new legislation to be passed. And that legislation says that a friend, a family member, or a friend, so it's written very loosely, so I could get it on you, go to the judge and file a motion for somebody to be assessed. That's basically saying they're a danger to themselves or others. And then the judge will take a counselor's assessment, a physician's assessment, the person who's addicted, their personal statement, and then the person who filed the motion, their statement. Take all that into account and decide, do you have a problem? If so, how bad? And what kind of treatment do you need? And they use that counselor and physician assessment to decide what type of treatment. And then they either go to jail or they go to treatment because it's an involuntary commitment to treatment. And the interesting thing is we for sure see no statistical difference between somebody like me who showed up because I wanted to be here or somebody that's forced into treatment. There's no difference because you don't have to want to be here when you get here to get better. Just at some point along the way, you have to decide that you see hope and light at the end of the tunnel.
All right, so I got a question for you now. Like, this has influenced, had a big, major impact on your life, obviously. But, was you a drinker? Did you like alcohol? And I know, I'm assuming now you can't be around those things because Matt can't be around. How do y'all, I don't know.
Well, we do not have alcohol in our home.
Right.
I'm fortunate if I were to go to dinner, I could have a glass of wine and it not destroy my life, and that'd be it. I could take a sip out of it and that'd be it. But it is something that we do not have alcohol in our home. That's just a commitment that I've made to him because there's no reason, nothing ever good has came out of alcohol, and especially in our experience. Right. So that's just something that we choose not to have it in our home.
I can tell you his Facebook post when we were testing his drinks for him.
Oh yes,
yeah. We can't be.
I'm the official. I am the official Matt Brown drink tester. So I test all the drinks he gets to make sure there's no alcohol in it.
If we go to Buffalo Wild Wings and get a cherry limeade, anything that looks potentially like it could
accidentally be contaminated. And so we try to have fun with it. It was a very difficult time in our life, but that's the past, and we can look back on some of those things that happened and we can laugh together about them, and today we can laugh about it, and I think that's really helped our healing process.
So Matt, there's clearly a lot of good things going on here, but do you ever get any pushback? Do people come to you and say, well, you're spending taxpayer dollars to help people who are addicted to drugs? Is there any pushback at all with the work you guys are doing?
That's a great question, Jimmy. And there is. What I would tell you, though, is at least in Louisa, where we're headquartered in Lawrence County, most of this community is for the work that we're doing. Now, when Tim started the organization back in 2008, there were major pushback. People were going door to door and leaving flyers out to basically using scare tactics, telling people that Tim was going to bust people from out of town urban areas, and it was going to be, we're going to ruin our city. And interestingly enough, the guy who led that effort lived in town, and he didn't want drugs in his town. And I would read about it in the newspaper because it was that big of there was controversy about Tim opening up Karen's place all over the place. And I was severely addicted, living in back and forth between Ashland and Louisa, and I would read about it in the paper. And I was living in Ashland, working in Louisa, and one of my drug dealers lived 2 doors down from the guy who didn't want drugs in his county. But he just didn't know it was already here. But fast forward to today, most people are for what we do, but there are people who don't fully appreciate the idea of using taxpayer dollars to help people in addiction. Because one of the things I didn't share, and I'll try to do this quickly, is if you rewind 10 years ago, in order to get help for a drug or an alcohol problem, you either had to be very wealthy and be able to afford $30,000 for a 30-day stay at Passages Malibu by the beach, or you had to be just completely homeless and be fortunate enough to end up in a Salvation Army type bed. And there was a very limited number of those types of beds. So treatment was for the wealthy and for the very, very, very poor 10 years ago. But the federal government created mental health parity acts that forced insurance companies to start treating mental health and addiction. The state of Kentucky expanded Medicaid, and what that means is they lowered the threshold for someone to receive state assistance. So today in Kentucky, more people have Medicaid than before. And then they created a drug treatment benefit for people that have a state assistance card, for a Medicaid card. And so Kentucky was the first state in all of Appalachia, and all 13 Appalachian states, to expand Medicaid and create that benefit. And what that meant is now people who need treatment the most can get it. And that has allowed us to grow because we're in one of the poorest states, in the country, and a lot of people have Medicaid. And what we've been able to do is help those people move from state assistance to taxpayer with that benefit that happened. And so to get back to that, we've always been using taxpayer dollars for the addicted. We're still using taxpayer dollars. We're just using them differently today in Kentucky. We've always put people in jail, which is paid for by taxpayer dollars. We've always subsidized hospitals, and we're treating the addicted inside of emergency rooms. Many folks that are addicted end up in an emergency room, multiple times a month, and taxpayer dollars help to subsidize those costs. Taxpayer dollars help subsidize the cost of foster care systems and child protective services, and much of that is because of the addicted population. And so using taxpayer dollars for drug treatment is just a reappropriation of those dollars. And it's more of a longer-term solution than some of the other things that I'd mentioned. But in Louisa, it's been different, though, because where Kentucky's it's leading. We're hardly ever leading in something other than basketball. But we're leading the way on this, not football. We're leading the way on this issue, and all these other states are looking to Kentucky and how we're tackling the problem. And not only was Kentucky first in Appalachia, but addiction recovery care was first in Kentucky to do this kind of work. Like tomorrow at noon, from noon to 1:30 tomorrow, we'll be in this same room here with a group of people from Baltimore who heard about what we're doing, and they flew in tonight and they're staying in Ashland or Huntington, and they're coming to Louisa to see what's happening here. And so I know I got off topic on your taxpayer dollars, but some people don't like it. but they don't understand we've always been using taxpayer dollars.
I like the idea that it's, you're using taxpayer dollars, but you're bringing these people in and making them taxpayers.
Yeah, and let me let me say something there is we've been identified by Health and Human Services Department out of Washington, D.C. They were tasked with finding the 21 biggest programs in the country that are taking people from welfare to taxpayer. And the research team that was tasked with doing that scoured the country for about 4 months, talking to the governors and the governor's cabinet members in every state. And they couldn't find 21 programs in the country that met their qualifications. They only found 12. And we were the second one they chose nationwide. So they're doing a study that starts in January. We have weekly calls with this research team that are headquartered in Boston, D.C., Baltimore, and Florida. And they're starting a 3-year study in January about what the success that's happening here from taking people from welfare to taxpayer.
That's great.
So, and I mean, this has really opened my eyes a lot of these because the taxpayer thing. I honestly would have had a different opinion, but that makes a lot of sense what you're saying. That it's a lot more beneficial going into this, and you're actually saving money on the other side. But one question I've got, because it's obviously you are doing awesome things on this side of addiction. What do you think can happen on the other side as far as prevention? One of the things we talked about last night was, everybody says education, which seems like an obvious answer, but when we were kids, we had the DARE program that basically just kind of taught us how to do drugs and where to find them and how to use them, right? So I'm just wondering what y'all's thoughts are on how do we even prevent from getting here in the first place?
So my opinion, I was going to defer to the teacher in the room, but one of the things that I've been saying for some time, knowing my wife and hearing her talk about being a teacher, is one of the things that I know is that teachers are assessed. So their supervisors, their superintendents, the state in general, they grade teachers on their end of the year assessments. And we're never going to have a meaningful prevention strategy as a state until those types of topics are tested at the end of the year. So until they put that on the test, teachers are never going to have the time. They're never going to put it on a high level priority, because, correct me if I'm wrong, you teach what they test, right?
We have standards that we're accountable. We have a list of we have a set of standards we have to follow for certain subjects, and that's what we have to teach. That's what our guideline is. We have to not assess the standards, but we have to teach the standards. And so you put priority where you put priority in certain places, and oftentimes those important things like drug education, they kind of get pushed to the side a little bit. I always try to have Matt come in once or twice a year to speak to my kids about, I teach third grade, so he doesn't go into, great depths about drugs and alcohol, but he mostly talks to them about good decision making and how the decisions they make while they are in third grade are eventually going to affect and shape who they are as they grow up. And so that's something that I always try to get him in once or twice a year to talk to my students about, just making good choices. And that's what, I try to teach that every day. The decisions we make, there are consequences for our actions. And so that's something that I try to incorporate in my classroom that will hopefully, help them on later in life when they're faced with those really tough decisions.
But they're blessed they're blessed that you had the misfortune of marrying me and going through all that, though. And so they get education that they may not get if there's a teacher that doesn't maybe value the importance of drug prevention and education. And so my goal with those comments about putting it on the end of the year test is to create a strategy for the whole state to where it's a focused effort on prevention. We had some friends of ours in from Louisville this weekend, and the husband is a husband and wife. The husband's a former drug addict. The wife's a former alcoholic, and they've got kids, and so they've are better versed in drug prevention for children. But what they found is that it should be age appropriate, and that you should start talking to your kids at 5 years old. And so they talked to their 5-year-old just recently about how that mom and dad are allergic to drugs. The verbiage they use is they're allergic to drugs and alcohol, and you might be too. And they were talking to their son about it, and he didn't even know what alcohol was, but they started those conversations this week.
What are some resources for people listening that have small children? You know, I've got older daughters, and then I've got little boys that are 4 and 7. So, you know, my wife and I had that discussion about, well, what's appropriate, what age, how far you go with the conversation. Are there some available resources out there or places to go as parents where you can get that information and kind of get some guidance into where those conversations should go for certain age groups?
There are. One of the best places to go is the National Institute of Drug Abuse, NIDA, and it's probably nida.gov or nida.org. And they have wonderful information that you can download, and it'll help guide you through what's appropriate when. And then also Operation Unite, which is headquartered in Prestonsburg. They have fantastic information as well about curriculum for prevention and education.
Okay, so I'm going to ask this because this is one of the things I told you I want to talk about is, and from everything I can find about needle exchange programs, it's nothing but positive. So you've been in the eye of the storm here in Louisiana, I know, trying to get this going. So kind of what is the needle exchange program and what's the pushback on it?
Okay, that's another great question. The funny thing about addiction is every topic's a hot topic. So a syringe exchange harm reduction program is a program that is set up to reduce the number of contagious diseases that occur because of intravenous drug use. That's their number one goal. So they want to reduce the spread of hepatitis C, HIV, and they want to reduce the amount of abscesses that people get when they shoot up. And not every needle exchange program is created equally. So some are ran well with compassion and dignity and accountability, and others are not. I'm very for needle exchange programs that are ran well. And so what that looks like for me, in my opinion, is a cap on how many needles you can get. And so at a certain point, after you've been in the program for a couple, 3 weeks, you ought to only get back the amount of needles you bring me. So if you bring me the 20 I gave you last week, then I should be able to give you 20 more. You shouldn't be able to give me 1 every week and me give you 50. So there ought to be some level of accountability there, because we don't necessarily want people throwing their needles down, because I want to reduce the number of needles on the streets. And 2, we don't want them, ideally they wouldn't sell their needles, but they would use them and bring them back. The other piece of it is any needle exchange program, in my opinion, worth its weight, ought to have resources available at the exchange so that if somebody comes in and doesn't want to use drugs anymore, they ought to be able to get help. So they ought to have connections to people like us and other programs to help them get help. So there's around 40 needle exchanges in the state of Kentucky. We have employees that go to half of those. We're not contracted, but we collaborate with half of those needle exchanges so that when their doors are open, we have a person inside the building that's got our brochures, that's got wristbands with our phone number on it, that bring coffee and cookies and milk and water and just love on people and let them know that there's a better way. And almost every person of ours that goes into those needle exchanges are people that are in recovery. And so they are actually peer support specialists, and that's something we haven't got into yet. But long story short, a peer support specialist is a person who's been clean and sober for a year, taken a class, a 1-week class, and passed a test. And at that point, they're certified from the state of Kentucky to be able to help you get out of addiction. And they learn how to talk to people one-on-one in a group setting, and they learn all the nuances of how to do what the science says best to help somebody out of addiction. Mm-hmm. So we rescue 12 people every month out of needle exchanges, and they come to treatment. Wow. And that in itself is enough for me to be for a needle exchange. If we have a shot at getting rid of needles off the street, if we have a shot of loving people when they're at their lowest point in life and just treating them like a human, and then getting them help, it's worth it to me.
And the pushback is? You're
enabling people.
That's it?
Yeah. You're enabling. Well, no, that's not it. Sorry. And then there's always some folks in the crowd that say you should give diabetics needles also. Oh, yeah. And what I say about that is we ought to figure that out too, but they ought to get a group of people together and go advocate for that, sure. Not against something else.
Matt, do you have an opinion on, the key buzzwords nationally are big pharma, and the doctors and pharmacists, and, this whole big chain of how it gets to the person? Do you have any thoughts on those different industries? Because, I feel like it's been proven that big pharma was pushing opioids in their area.
Yeah, I do. Surprise, Summer, right? Summer's the most surprising room. So I know that I've got a lot of friends that are dead now because of Purdue Pharma.
Me too.
Yeah, and the lies and the propaganda. And, I know for sure that the day they created OxyContin in the lab, I know for sure there was high fives all around the room because they had finally created synthetic heroin. Nobody will ever tell me differently that they didn't know. And they sold it to physicians who didn't get any training on addiction in school. Physicians are just now getting trained on addiction in school. And they sold the physicians a false bill of goods. Some physicians were naive. Some saw the money. But I think that was a smaller percentage. I don't think that they were all just bad. I think a lot of them were naive to a point. And they knowingly flooded this region with pills. I could get OxyContin. I lived in Ashland. And I could get it everywhere. That Dreamland, the book Dreamland by Sam Quinones, talks about the physician in Portsmouth who kind of which were really started. It was everywhere. I would go I could go into probably a dozen houses in a mile radius in Ashland and find a dope dealer that had a Ziploc baggie full of OxyContin 80s. Which were going at $80 a pop. And think about how much that street value was. And it was everywhere. And, tons of people that I know aren't here because of that. I don't think it's the same today. I think that people are better educated. Kentucky's passed some laws. Now you can't, in Kentucky, there's prescription limits to where if you're going to go over 3 days, the physician has to write why and jump through a few extra hoops to write a longer prescription because they've proven that if you've got a prescription for over 3 days, your likelihood of addiction can go up. And I'd mentioned earlier, med schools are now teaching people about addiction in a way that had never been talked about before, and there's a lot more science behind the medical treatment of addiction. And the interesting thing is 10 years ago, you had to be rich or poor. And it was not. Addiction treatment wasn't in the healthcare system 10 years ago. It was in the ministry world and the mission world and the nonprofit world. It wasn't a part of the healthcare economy. Today in Kentucky, addiction treatment has its rightful seat at the healthcare table. And what that means is it's improved quality of treatment because you have to get state licensed. And so they come out and inspect, and you've got to be doing things well. You've got to be accredited, so there's an accrediting body that comes in and kicks all your tires and makes sure you're doing everything correctly. And insurance companies won't pay you for substandard care. So you legitimately have to be providing quality care in order to be reimbursed. And so what that has done is it's allowing us in Kentucky to create processes for somebody that's addicted. So let's say somebody has a heart attack. Today, the healthcare community knows exactly what to do with that person. The next year of their life is mapped out. You know they're going to go to cardiac rehab, and you know they're going to do this, and at 6 months that. And in Kentucky, we're getting to write that for the addicted because we're part of the healthcare economy. We are getting the opportunity here at Addiction Recovery Care to help start those conversations and finish them, from mom who found out daughter was addicted all the way through to employment. And that's helping more people not have to feel like Summer did when she didn't know. Guys, 5.5 years ago when it all crashed, was there anybody in Louisa getting better?
Absolutely not.
Did you have a clue where to turn?
Had no clue where to go.
And it is different today, at least in Eastern Kentucky.
So, guys, I know we're getting short on time, but I want to kind of leave it with this. If there's somebody listening to this podcast and they're struggling, they were where you were, Matt, or you, Summer, as a spouse, what would you say to them to say, hey, it'll be okay, but here's what you got to do? What would you, if you could say something to those people, what would you say?
I would definitely encourage anyone, even though I personally never did get to go, but in my research of trying to figure out what to do, I believe it's called Al-Anon, and it is for the loved ones of those that have someone that is an addiction. So mothers, fathers, sisters, brothers, spouses, there are support groups out there that you can find. I think they are more in larger areas. I believe Ashland, Huntington probably has an Al-Anon. But I definitely encourage anyone that is going through what I had to go through to find a support group, reach out to someone. Know that your journey through this is not going to look like anyone else's. It's not going to look like mine. It's not going to look like the person next to you. It's going to be your journey, and really just find a way to walk through that journey, whether that's sticking with your spouse or whether that's moving on in a different direction. There's no wrong way to go through it.
That's right. And what I would say is, if there's somebody that's struggling with addiction or has a family member struggling with addiction, one, I would say there's, as long as that person is breathing, there's a chance at recovery. And what I would also say is, we today have a 24/7 hotline that's staffed around the clock that people can call to get more information about treatment. That number is 606-638-0938. And we have a staff of 27 people in our addiction help hotline department. And at least probably 60% of them are in recovery. But they are the specialists when it comes to helping someone get help. And then we also have a website, arccenters.com, that can also show someone all of the facilities that we have and the types of care that we have. But I just know this for a fact. I've blown through probably $2 million on drugs and alcohol, and I was in dire financial straits. Should have been divorced. I should be dead. I shouldn't be sitting here with you guys today, but God had other plans, and part of those plans were He called other people to create a business that helps other people. And I believe that if somebody can just get to one of our facilities, they have a chance at a whole new life.
Guys, I don't know that we can thank you enough for doing this tonight. I mean, just thank you.
You're welcome. Thank you guys, seriously, because it's important. I mean, we've literally given our lives to this effort, and because it was hell for me for 18 years, and you for 5 or 6.
3.
Yeah,
we're very fuzzy. We're very fuzzy on the numbers.
We still try to decide if we've been married 7 or 8 or 9 years.
I don't know. I think we're going on 8.
One I'll leave you with something funny. Is one of our friends, one of Summer's friends, had posted on Facebook. Somebody had been married for a year or 2. It was their second year anniversary, and the person put, well, it should be all uphill. How was it? They said the first year is the hardest year.
Yeah. Yeah, it was like, people say the first year is the most difficult. If that's true, then the rest of the years are going to be a breeze. And
yeah, and Summer's like, actually, the first 3 were the hardest.
Yeah. First 3 for me.
Yeah.
I always say if we've been married for, we're going on 8 years, I'll say, it's been the best 5 years of my life. Yeah, it's been the best 5.5 years of my life. So,
guys, for real though, I mean, Summer received, in my opinion, divine intervention through this process, though, because if there was a book to be written about how a spouse walks alongside of someone that was addicted, she's done. Not so much until I went to treatment.
Yeah.
That part, don't write that book. But once I entered treatment, she's written the book on how to walk along somebody, not constantly throw it up in their face, trust, slowly but surely build trust. Somebody asked me the other day if Summer trusts me, and I said, well, I think she trusts God, not necessarily me. And you've kind of just decided that it's going to be what it is.
I can't. Nothing I'm going to do is going to prevent him from a relapse. And so having to let go of that, because I'm a little bit of a control. I like control. And so letting go of that, knowing that, like, I can't be responsible for his recovery. That's him. Like, I can't prevent the relapse. I can't prevent anything. That has given me a lot of peace. And a lot of people might think, oh, that's really scary. But for me, it's done the opposite. It's given me a lot of peace to trust him, trust the process. I don't throw anything up in the past.
Never. Ever. I
never, throw up, oh, you remember that time you pawned all, like, that's the past.
Unless it's a joke.
Like, if we want to laugh about it. But I would never, in anger, throw something up in his past, because that's not who he is today. And I think...
You have a sister?
I don't.
If you do, nowhere near him.
Yeah. That's great.
Nowhere near him. Well, guys, I can't think of a better place to end it. We really appreciate you guys listening. From Brad, JD, and I, thank you for listening to the Just Add Bourbon podcast.